So let's go ahead and start this webinar, Chronic Pain in Military Families. Just to give you some quick programming notes, all of you guys have been muted. It just helps us hear the speakers a little bit better. The Q&A function at the bottom of the screen is where you can type questions. We don't have the chat on right now, but through that Q&A, which is at the bottom of your Zoom bar, you will be able to submit questions, and we will have our panelists as well as our subject matter experts there to respond to you in real time. We will have a presentation followed by a quick conversation with one of our wonderful veterans, and then we'll have a Q&A where we'll bring the speakers as well as our veteran on to have a larger conversation. As we like to remind you, we will be sending a survey at the end of this presentation. Tell us what you like about it. Tell us what you want to learn more about. Tell us how we can serve you better. All righty. Right now, I have a poll on the screen. We want to better understand your reason for coming to the webinar today. We want to know what is the biggest challenge in your family right now. So if you look at the screen in just a second, a poll will pop up on your screen. I'm going to start it now. Alrighty, it is going to give a couple of seconds. We've got some answers rolling in. I'm going to give it about 14 more seconds. Answers are coming in. Thank you, guys. We're seeing a lot about maintaining routines, communication about pain, caregiver stress. Wonderful. I'm going to go ahead and end the poll and share the results. So as we can see, about half and half for routines and talking about pain, caregiver stress, and finding time for connection. We don't have anyone that put talking to children, but you also never think about children sometimes when we're talking about pain and the overall experience. So what we're going to do is go ahead and move forward with the presentation. Let me go to the next screen. And I want to introduce tonight's moderator. You guys are in for the treat. We have Robert Santiago, the Commissioner of Veteran Services for the City of Boston. Robert Santiago was Boston's first Puerto Rican LGBTQ Veterans Commissioner, is a 20-year Navy veteran who served in multiple global operations, and he chairs the Military and Veterans Service Committee for the Massachusetts Leadership Board, and he joined the National Arthritis Foundation Board in 2005. So I just gave a little bit about Rob, but he is going to join us through the rest of the presentation to really talk to us from the experience side, to talk to us about his life, his work, and how we all can work together. So I am going to share and bring it over to Rob.
Thank you, Asia, and good evening, everyone. It's definitely a huge pleasure for me to once again be here tonight with all of you as we talk about what affects our military veterans when it comes to chronic pains, but also delve in a little bit more and talk about how that also affects our veterans. I'm also a mission ambassador with the Arthritis Foundation, and I've recently completed my first California Coast cycling experience, and was also down in DC for the Arthritis Foundation's Advocacy Summit a couple of weeks ago. One of the things that I want to talk about is that, across our nation, veterans are more likely to live with chronic pain than any other group of Americans. Nearly 1 in 3 veterans live with chronic pain every day, and that's almost double the national average. And for many, that pain is severe and life-limiting. For veterans who served in combat zones or in physically demanding roles, the total is even greater. Many of us were raised in the military culture of push it through or push through it, don't complain, and embrace the suck. Musculoskeletal injuries are the #1 cause of disability claims with the VA, and chronic pain is also a leading contributor to veterans' unemployment, depression, opioid dependence, and also risk of suicide. So this isn't just pain, it's a quality of life issue. But like I said earlier, it's also a family issue. Chronic pain doesn't stay contained within the person experiencing it. It also affects marriages, parenting, careers, and also mental health. So when a veteran is hurting, their family often carries that weight right alongside with them, physically, emotionally, and in some cases also financially. Families drive them to their appointments, adopting daily routines, helping them navigate the healthcare system, and sometimes just trying to get through the day. Family members often also become informal caregivers, not knowing of what they're doing because they haven't been trained or supported. So you see, pain impacts the whole family, and healing will require us all of us as a community. So in today's journey, we're going to approach this from two essential perspectives: the clinical expertise perspective and the lived experience. You'll hear from healthcare providers about evidence-based strategies, then from a veteran himself and his journey. You'll leave with concrete tools for communication, maintaining relationships, supporting our children, and preventing burnout and accessing resources as well. So right now, I would like to introduce our panelists for tonight's discussion. First, I want to introduce Dr. Chrissy Salley, a pediatric psychologist. Dr. Salley specializes in family systems and military families. She's going to discuss family dynamics and child impacts. She also serves as Director of Clinician Engagement and Outreach for Courageous Patients Network. Then we have Dr. Jessica Leavell, a pain processing therapist and clinical psychologist who specializes in mind-body therapy for chronic pain and is certified in pain reprocessing therapy. She is going to discuss signs of caregiver burnout, the mind-body approach to self-care, and effective communication strategies. Lastly, we also have Ed Flynn, a retired United States Navy veteran. I personally know him as my City Councilor Ed Flynn. So he's not only a shipmate, he's also a very good and dear friend of mine. Ed, who is also living with chronic arthritis, will share his personal journey and we'll discuss experiences as well. So right now, let's jump right into it. We'll start with the clinical frameworks, then hear about these concepts play out in real life. All that I ask, and I just wanted to reiterate, to please hold your questions until the end. We are going to have dedicated time for your questions, your concerns, and also your comments. So let's dive right into it and begin by understanding the invisible ripple effects of chronic pain that it creates in families. So Dr. Salley, we are going to start with you.
Great, thank you so much. Thank you for having me here this evening. I'm so pleased to be present with all of you to talk about one of my most favorite topics, which is families, and especially the family experience when there is one or more individuals in the family who are contending with something unique in their life circumstances, particularly medical conditions. Next slide, please. We're going to set the stage a little bit about why we talk about family impact. It may seem obvious and it may not seem so obvious at times. So I think it's important to review why and how a family is impacted by one person's health condition. And for two reasons. One is because knowledge is power, and understanding these processes could be helpful as you think about what can be most helpful to an individual in the family or the family as a whole, but also to validate that if you are noticing these patterns or experiences in your family, that you're not alone, that it's very common for a person's health condition to impact other people in the family. Next slide, please. So I like to draw this diagram to illustrate the connection between certain family members and the individual with the condition or who's affected by the health issue. So if we think about this, I think already you've heard tonight this idea of a ripple effect, and chronic illness or even acute illness really does have a ripple effect. So you can think of it as this imagery, when you throw a pebble in the pond, there's obviously the initial impact and the splash, but then there are ripple effects that go on for some time. Certainly the individual with the condition affects that chronic nature and the impact over time, but the people that love that person do too. So you can imagine it, if you're a visual learner like myself, like this image on the screen, where you can think of the individual with the condition being in the center of a family, and then there are people who are going to be more or less impacted by that condition, depending on the strength of their relationship or the closeness of their relationship to that individual. So in the case of arthritis among military families, particularly if we're talking about, for example, a parent or spouse with the condition, they're at the center of this circle. And then those that are most likely to be most impacted by that individual's condition are close family. So we're thinking about the people in most situations who live in the same home as that individual. So this might be children and maybe a spouse or a partner. And then as we get further away from that person, the relationships are a little less strong, although the impact could still be present. So thinking about extended family and friends, and then at a wider level, the impact potentially on the community or the exchange of the community's reaction and interaction with that individual. Next slide, please. So not only do the people in the individual's environment have a relationship to this person that they love and care about, they also have a relationship with the condition. And I'm really glad to be able to talk with you about this evening, because this exact topic came up just yesterday in one of the families that I work with in my clinical practice, where one person in the family who has a serious health condition asked another, "Are you mad at me for having this condition?" And so we talked about this visual right here, that the loving person in the family is not mad at the person with the condition, but they do have a relationship with the condition itself. So this separates the affected individual from the health condition, such that when you may not, as a loved one, resent the person who has arthritis, but you can resent arthritis. You may not be upset when the person's arthritis flares and interrupts family plans, but you can be upset that arthritis does function in that way sometimes, right? So I think that when we separate the person from the condition, it might be helpful in terms of thinking about our own emotional reaction to the condition, and hopefully providing some relief from the individual carrying that condition, so that they're not to blame for the cause of the issues. It's the condition itself. Next slide, please. So we're going to talk for a moment about talking about pain. When we're talking about children, we of course think about child development. You probably have heard the phrase developmentally appropriate communication with children about a number of issues. You can go on to the next slide. But developmentally appropriate or age appropriate, whichever you're thinking of. Now, those are highly correlated, but I like to think of developmentally appropriate, because age appropriate sometimes implies that at this age you do this thing. And when you think about developmentally appropriate, you can zoom back and look at the big picture of where your child is developmentally. For most children, the areas of development are not perfectly 100% matched with one another, right? So some kids may be academically gifted, but emotionally, like more similar to others their age, or emotionally behind, or they may be socially ahead and academically behind, right? So development is a little scattered. So I think thinking about the developmental place that your child is in, whether they're a very, very young child, like preschoolers, all the way up through adolescence, and even beyond, right? So if you are a parent, you have that parent-child relationship through the extent of the life of the relationship. So you're still communicating with family members about your pain, even when they're older or outside of the home. Next slide, please. I'm going to give a few tips about communicating about arthritis or pain within the family. One helpful tip is that when a child comes to you and asks a question, it is always a nice idea to ensure that you're answering the actual question. So oftentimes children, and this includes adolescents, especially if they're kind of avoidant or tiptoeing around a conversation, they may ask a question that is somewhat vague or unclear. And it is often helpful to follow up to the question with curiosity and responding with a question to clarify what it is they're really wanting to know. So, if you have a very young child and your loved one has gone to the hospital and the young child says, is dad ever coming home? Or when is dad coming home? Could that mean like dad's going to be home for dinner tonight? Or is this child afraid that the parent has gone to the hospital and they may never return home and die because they one time had an experience with a family member who went to the hospital and died? It's really hard to know. So I think you can follow up with things like, tell me more about what you're asking. I want to make sure that I answer your question correctly. What's on your mind? What's bothering you? You can also always keep in mind that responding honestly and directly is always the best policy. It is not always the easiest policy to follow through, but to the extent that you have information, you want to think about where that child is developmentally, but give them accurate information. That may come with more or less explanation and level of detail depending on your child and family needs, but giving honest information is always the most helpful. even if it causes someone, a child or someone, an adult in the family, to be more concerned or worried. We can then, as a second step, help that individual cope with their worries, but it is important to give honest information that maintains the integrity of the relationship, which above all is most important. It lets them know that they're never going to be left guessing. Oftentimes in children, especially young children, when they don't have accurate information, they fantasize and make up scenarios that might be even more scary than the truth. So you always want to give honest information. I like the idea of planting seeds for what's to come. So if you know that there is a major change that's going to take place in the family and you can anticipate that, you can start sharing small amounts of information over time so that there isn't a moment where a shocking piece of information is delivered. And of course, when you're speaking with anyone in the family, you always want to validate and relate to the feelings that they're expressing. So, you acknowledge that I'm disappointed too. I'm also frustrated our plans were canceled. It's okay that you're feeling angry that this isn't going as planned, and really to make that emotional connection. Go to next slide, please. So of course, when we're talking about, well, any human, because most of us enjoy routines, but especially children, where we're always encouraged to follow routines, it can feel counterintuitive when you know that your family has something going on that makes routines extra difficult. And that may bring along some guilt with it, right? So, a pediatrician or a mental health provider is always going to say a child works best with routines or with things in a certain way or to have predictability. And you cannot meet that 100% with your child. So it's natural if you have some feelings surrounding that. So next slide, please. So within your family, you want to, the best of your ability, to create basic routines and a framework for routine where you can, but also allow for flexibility. And when you present children with small doses of change and need to be flexible over time, they, in most cases, will accommodate and learn to live that way. And so, you can build structure about certain things that are, non-negotiables, like going to school, right? So maybe you have a backup plan for transportation to school if you're unable to take your child to school. You may say their participation on the local soccer team is so critically important that we will have a backup plan for someone else to drive my child to soccer practice. But there are other things that we may have to pass on as a family if it comes down to it. And I love this final bullet here about focusing on progress, not perfection. This comes up a bit later in a moment where you talk about the little things that are so important. Sometimes we hear the language, milestones, like meeting milestones in development or meeting milestones in life. But so much of what we do in life, we're raising children or when we're contending with unique circumstances, is focusing on those end stones. So like just the little wins are what we can focus on most and really celebrate. Next slide, please. And next slide. So there are lots of ways that you can think about harnessing, your family's resiliency and closeness together. You can hold weekly check-ins if that sort of structure works for your family. Although if that may be too much talking about it for some families. So you have to take an overall look at your family and your needs for communication and think about how things are going. As I mentioned before, celebrate the small wins. Those are actually huge. Certainly want to prioritize connection over anything else. So that can come in small moments, being together, validating emotion, having any sort of shared experience to build the closeness that is most important in a relationship. And that includes the honest communication. To the extent possible, avoid the shoulds. Don't should on yourself. You may have heard that phrase before. We should be doing this as a family. We ought to have done this. We're not meeting this expectation. And when you're living with a serious illness or a chronic health condition in a household, shifting expectations to be more reasonable, also hopeful, but that can shift a lot of the weight that comes from, that we put on ourselves to burden ourselves to meet things that are really unattainable. So shifting expectations, celebrating the little wins, always a good way to go. And with that, I'll turn it over to Dr. Leavell. Did I pronounce that correctly?
You did pronounce it correctly. Sorry. I was a little slow there. Thank you so much. So my name is Jessica Leavell. I work directly with clients that have chronic pain, chronic health conditions, doing treatment, but also helping them navigate life and family life. And my focus is on really the holistic mind-body care. And so piggybacking on what Dr. Salley was talking about, a big part of like going further on the communication piece. Can I have the next slide, please? Thank you. I just want to talk a little bit about how complex the emotional processes can be for people, everyone in the family. There's a lot. I think that the person with the pain and the family members have very similar types of strong negative emotions, self-defeating thought patterns that build on each other, and that is piggybacking on the I should be doing this, the what ifs, and then thoughts about themselves and grief and so many complexities and layers to the emotional experiences of all family members. And what happens often with that is emotions are repressed. People I'm just gonna keep pushing through, do as much as I can, but not. What happens is that the emotions are pushed down, but the body still feels them. And so over time, that can lead to frustration, arguments, disconnection in the family. And within this complexity, it sounds hard to overcome, but really just a few small tweaks in how you communicate with each other, just in terms of, okay, let's help everybody feel like they can say, because all emotions are safe, all emotions are valid. So in all fears, you want everyone to be able to communicate, here's what my emotional experience is, here's how I feel, very openly and honestly. So that these, because what can happen is we start to try to fill in the blanks. What's my spouse or partner thinking or feeling? The emotional brain fills that in with often over-interpretation in the negative sense of the nonverbals or tones. And this is all anxiety and worry and fear-based, misinterpreting communications and just general miscommunications. So if we just kind of said there's some really specific strategies that is very collaborative and problem solving and open. So setting time aside for these conversations can be very helpful. In the moment, maybe stressors and tensions are flaring, we cannot calmly communicate the depth of our thoughts and feelings because the emotional parts of our brain are kind of taking charge. So it's good to say, okay, we both are feeling like we need some changes, or we all are feeling like we need some changes and want to be heard and understood. So let's set this time aside, and everyone has clear expectations, whether this is the spouses and partners or the whole family, clear expectations that they're going to be heard, and doing the best that you can to actively listen. So that means paying attention to verbal and nonverbal cues, which will help you really understand how, to a deeper level, how that your family member is feeling, but also providing that for them. Being aware while you're doing that of your own emotional triggers and having some strategies for self-soothing and coping during these hard conversations. Just trying to just keep your ears open and lead with empathy. Everyone's going into this with the intention of, I need to understand their experience as best I can. They need to understand mine, and then we can problem solve. We can identify what we need and collaborate on how to problem solve that. So when you speak, when each individual speaks, it's respectful, and you try your best you can to release the judgment, or at least the judgment or anger or anxiety, or at least more about identifying that emotion and allowing it, so that you can process it in the moment while also finding ways to self-soothe so you can keep your, your listening ears open, state clearly your thoughts. So I messages such as I feel overwhelmed, instead of you messages, which is you never help. And those are absolutes too. That just black and white, you never help. And that's rarely the case. So I messages, often I sit with clients and have them go through this process. When this happens, I feel, and then to say because, so that the other person can more deeply understand all the factors that are causing, because a lot of times it could be the relationship issue, could be they're just in a lot of pain that day, could be they're burnt out. So the why can be very helpful too. And then collaborating and problem solving together. So identify specific needs and goals, think of a plan together. And so in my work, it's often as simple as I need more of something in terms of support from my partner. How do I ask for that? And so it's as simple as stating exactly what you need or what you're looking for with love, empathy, and openness, and collaborating with the other person on how to get there, and then trying to follow through as best as you can. And when you don't have grace with each other, it's not easy, and you're human, and so sometimes it'll be hard not to get caught up in your emotion, and that's okay too. It's just be aware of it so you can acknowledge and shift as you're moving through life. And just having regular check-ins is really helpful and important too. So can I have the next slide, please? I want to talk a little bit or a lot of it about caregiver stress and burnout. And my overall thought is that this is very similar experience with some minor differences in terms of what the person with pain is experiencing emotionally, mentally, physically. So we talk about this pattern. A lot of people come from a place where I'm very responsible and I want to care for and do everything I can to help my partner, my spouse, out of love, and slowly more and more taking on more and more demands. This can be a gradual shift, right? The caregiver trap, where you're slowly, okay, especially if you have children, you're doing more of the driving around to support, because we eat in part with partners, you have your own things that you help with. And that if your partner's doing less of that, you slowly take that on. But you're doing that in addition to everything else that you were doing and all the ups and downs that come with life. And then you start to lose touch with yourself. You start to lose connection with your partner, and it just becomes more about doing and getting through. And you can lose, just as your partner with pain starts to struggle with identity, you can as well, because it can become focused all on the doing and the caregiving and the getting through, and then you lose sense of yourself. You don't participate in the things that fill your spirit, fun things, and things that connect you as partners. So it's just very important. I'll talk more about this when I talk about balance and self-care, what self-care actually is in terms of, well, how do you balance this out? But what can happen, can I have the next slide, please? I'm going to talk about burnout. Okay. So burnout is basically a fundamental imbalance in your body and nervous system. I'm going to try to explain it through the process of different types of stress, how it progresses. Okay. So stress in and of itself, necessary, self-protective, acute response. The body has this beautiful ability to create homeostasis, to balance itself back out. It's really built into our genes. nervous systems. So the stress response system is a feedback loop. So when you have a stressor, it sends a chemical signs to get everything activated to fight or run or freeze. And then that it facilitates all those systems to do that. But then once the stress or danger is past, there's also a little message that goes back to the brain that says, okay, you can shut off now. And then your self-soothing parasympathetic nervous system can start to calm you down. And so you get that and bring you back to balance. So what happens so then we can get into chronic long-term stress, which I think most people feel like they feel all the time, even without these added burdens that we're discussing today. And that can, even low-level chronic long-term stress, it starts to, because the nervous system is activated all the time, it starts to affect it causes changes in the brain, temporary changes in the brain. It starts to affect and wear down your body a bit because it impacts all systems. And so your balance is a little off, a little to a lot. But burnout is just pure. I've been sending you all these messages that it's too much. I can't do this. It's your body telling you, I can't keep up with what the output that you're expecting. So you become very physically and emotionally depleted. But so basically your nervous system is fried. What happens temporarily, what happens is just it leads to these emotional exhaustion symptoms, increase in physical symptoms, emotional experiences that are very different from who you usually are. Okay, and this is what happens when we're in autopilot, taking on more and more. Stress response is working most of the time, and we're not taking care of all the areas of our life. We're not keeping that balance, which is I like to help people learn, like, that is very essential for your health, mental and physical. It really does have an impact. So just to talk about signs to look for, obviously emotional exhaustion, but I want to be a little bit more detailed. It's just so that you can get into a general feeling of overwhelmed, completely drained. The rest doesn't help. Emotional experiences of hopelessness, increased anxiety, and or depression symptoms. Now that could be worsening if you already had them, or even new temporary conditions. So feeling like you can cry all the time. This is emotional dysregulation, like small things, it feels like will bring you to tears because you just can't imagine adding another thing in. Your body can't imagine. It just feels so hard, insurmountable. People also become more frustrated and irritable and cynical. Some people talk about, like, I was a very empathetic person and I don't even have the energy to feel that now. And that feels weird and funny, and people are uncomfortable with that. So, and then these emotional experiences then bring on guilt for feeling that way, or for becoming, or the behaviors of being irritable towards others. So it's just a feedback cycle in and of itself. Mentally, it's very true that our memories are impacted by stress. We can struggle concentrating, we'll get forgetful, might notice that increased in negative thinking, having a harder time shifting your mind to a more balanced or positive perspective on something. And this can feel very out of character and uncomfortable. The cognitive symptoms can just feel scary for people. And what this can lead to also in terms of day-to-day life, you withdraw socially. So if you're noticing this comes on very slowly. So as you're taking on more and more, right, you might not notice at first, and then you might start to notice, I don't feel like going out anymore, and you become more isolated from your friends, or I don't have the energy to exercise or to participate in this activity that brings me joy. And so those things that help balance you out emotionally and physically are slowly fade away slowly over time. And then also neglecting your own physical health is a big concern because you don't have the energy or the bandwidth to do that with everything else going on. And so it's easy to push that aside for later. So I want to talk about reframing self-care and what is self-care. Can I have that next slide, please? Okay, I want to bring up the self-care diagram of the next one. I'd like to talk through that. Yeah, thank you. So self-care is essential for the person with the pain and illness and their caregivers and their family, because it's essential for everyone to maintain balance. So it's really multidimensional what self-care is. And this graphic, I hope, helps break down the different categories that become unbalanced when you're doing or on autopilot just to get through, right? Okay. And the other pieces slowly start to fall aside or get ignored. So there's your physical well-being, and I can't emphasize enough how important sleep is for all of this. It's difficulties with sleep comes with all this stress, but it's also our time of sleep helps our brains recover and our bodies recover. It really, really does. So anyone who in the family who's having troubles with this, please honor that and get help for it. And there's great CBT treatments for insomnia, and you can get being assessed for apnea or other sleep disorders can be very helpful. Okay, so I'm running out of time, but I try to help people shift to get these various self-care strategies back into your life so that you can get yourself back balanced. So emotions, people, social connection, spirituality, lifestyle, relaxation, goal setting, values, that's all essential. And okay, so thank you so much.
Oh, thank you, Dr. That was some great information. Now I'm looking forward to having a conversation with a veteran and a good friend of mine, Councilor Flynn.
Commissioner, it's good to be with you, and want to say thank you to the Arthritis Foundation for hosting this important webinar this evening. I listened closely to both doctors, and what they highlighted really resonated with me and the struggles I've had with arthritis and the impact it can have on families or your spouse, and how you communicate with your family is also critical. When I was diagnosed with arthritis, I said to the doctor, I said, how can I have arthritis? This was years ago. I said, I'm a young person. That's for older people. But then I get all my medical care from the VA, and the doctor was excellent. And he said, well, a lot of veterans have arthritis, and it has an impact on your physical health, but it also has a impact on your mental health, including your family as well. And so, I did some studying and learned about arthritis, but also the impact it has on families and in mental health. But what I got most out of it is trying to be honest with your family and trying to be honest with dealing with pain and how it impacts you. And as we know, as veterans, I served proudly, and as my good friend Rob did, proudly in the United States Navy for over 20 something years, and served on active duty after September 11th. But I have to acknowledge that I'm a different person than I was years ago, and my health declined and probably had an impact on me and my family. But I'm grateful that I had exceptional medical care at the VA in Jamaica Plain and in West Roxbury, and including counseling that I still attend. I find it helpful to me. And I initially didn't want to go to counseling because I said to my wife, I said, I'm a Boston city councilor. I was the former city council president. And I said to my wife, I don't want to go to counseling. What about if people people find out that their city councilor or the city council president is in counseling. And my wife, Kristen, said, well, you have to do what's best for your family, but you also have to do what's best for your constituents also. And what's best for your family and your constituents is following through on your medical care. And that includes counseling. And then my wife said to me, well, maybe also it's an opportunity for you to help other veterans. And that's the only reason, or the main reason I should say, that I'm here tonight is I want to help other veterans that have arthritis and have chronic pain, to let them know that there's help for them, there's help for their family. But the worst thing you can do is to keep it secret and not get the medical care that you've earned, really, and that your family has earned. And when you get that medical care, you're healthier, your family is healthier and happier. And that's the only thing I really strive for, is to be a good husband and a good parent. Those are my two major responsibilities, other than certainly being the best elected official I can be. So I'm fortunate in my life to have the care I receive, but I also want to advocate for others that don't have the same access to care that I have. But for the veterans out there and their families, there is help. And there's a lot of people that do want to help and support veterans at the VA. I know they have excellent programs because I've been there, I've benefited from them. And I think it's critical for all veterans to access their services and programs that they've earned. And it makes you a better person, it makes you a stronger person, a healthier person. But probably the most important, it really helps your family the most. And that's what I think we're all here for, is to support our families and making sure our families are happy and healthy. So that's my story. And I hope by sharing this, I'm able to encourage other veterans to learn about arthritis, but to learn about how to deal with pain and to access their benefits. I think that's critical. Thank you, Commissioner, and thank you for leading this important discussion. And what you're doing, Commissioner, tonight is bringing people together, bringing veterans together, letting them know that they're not alone in the struggles they have with arthritis or pain management. And the Arthritis Foundation is bringing us together so other veterans can benefit from our stories. And I think that's what's important for us tonight to share. Thank you, everybody.
Well, thank you, Councilor, for sharing that. And I got to say that it's been a journey for me too. And just listening to you tonight and your honesty and how you deal with this pain, and how your family, particularly your wife, has supported you and also led you to make the decision that you needed to make to go to the VA, to take care of yourself, take care of your family, but also take care of your neighbors and your constituents, is huge. In our business, a lot of times we get caught up in taking care of everybody else, and then we forget about ourselves, and sometimes our families as well. So hearing your story and hearing how you went ahead and took care of yourself, and then by doing so, you've taken care of your family as well as your neighbors, that is very powerful, and that is very impactful. I will share this, and I know this is about your story, but I do feel like I do want to share one quick story of mine and how I became involved with the Arthritis Foundation. It was basically a cold call, and the cold call came from Erica D'Agostino, who's on this call, about wanting to work with the City of Boston Veteran Services in reaching our veterans and giving them another resource, talk to them and let them know that the Arthritis Foundation is also there. And oh, by the way, all the services and benefits that you get through the Arthritis Foundation is also free. And I thought this is a great opportunity to partner with this great, wonderful organization on behalf of our veterans. Little did I know that I myself was going to need these services and benefits as well. And in doing so is how I was able to get even more involved in the Arthritis Foundation. And it gave me a call to action. And this call to action is just what we're doing here tonight. Now, you mentioned you're thanking me, but I got to thank all the people that are on this call. I got to thank the Arthritis Foundation and everyone on this call, and also the community as well, the veterans community and everyone that's out there that suffer or family of those that are suffering from arthritis, because we're all in this together. So listening to you and your honesty and how you are dealing with it and how you're making it your call to action in taking care of yourself, your family, your community, and our fellow veterans is just very inspiring. So thank you for that.
Thank you, Commissioner, and honored to be here and proud to call you a friend as well, Commissioner. Thank you.
At this point, we're going to go through the Q&A portion, and I will turn it over to Asia at this point. Back to Asia.
All righty, guys. So we are really grateful to have had all of these wonderful people here on the panel today as well as speakers. So we're going to go into a couple of questions that we were able to gather through those of you that registered. As a reminder, the Q&A is open. So if you have any questions outside of the ones that we asked, we'd love for you to put them in the Q&A, as well as our speakers. And Ed, you are more than welcome to use the chat function to put any links or resources that you think would be beneficial to go along with this. But in terms of the Q&A, I want to start with you, Dr. Salley. So how can families encourage open conversations about pain without making it the center of family life?
It's a really good question. So that's alluding to balance to some degree, whatever balance means to us as families and as individuals. But the idea is that's coming through here is, how do we have open and honest conversation without overdoing it and making it the family's full identity, right? And I think that what I would suggest at first for you to kind of, I call it like zoom out, take a step back and be an observer of your family and ask yourself, what kind of communicators do I think I have in this group of family? What is our tendency in this family? Are we avoiders? Do we talk about hot topics? Or are we talking about stuff all the time? Or are we somewhere in the middle? Like, what is our baseline communication like in our family? And then that can help provide you with some guidance. Do we need to find ways to open the dialogue more? Or do we need to find ways that are more strategic in terms of like tabling the conversation or scheduling discussion time points? I would certainly, if your family leans towards not talking about things a lot, we talked earlier about maybe setting aside a meeting time where these things can come up in a family. You can also jot questions down, right? Or suggest family members put topics in a jar and then you address them at a later time. And I think that you can certainly and should certainly check in with each family member about how they're doing from time to time as it relates to the family member's health condition.
Wonderful. Perfect answer. Again, I'd love you guys to add some Q&A in there, because what Dr. Salley just said, again, was pretty much about balance. So as you guys think about her answer, go ahead and add some feedback and thoughts in there too. So I want to go to Dr. Leavell. How can partners talk about needs and boundaries when one person is in pain and the other one may feel helpless?
So that is where the really open, honest sharing of experience, each person's emotional experience comes in, which can feel overwhelming because of all the complex emotions about that. But also these small shifts in being able to do that help you understand each other better. And then there's less of, assumptions or misinterpretations. And so you understand each other's emotional and day-to-day life experiences in a deeper level, which that's just the basis for understanding, okay, now I see why you're trying to get to, now I see why this is so hard for you, because the caregivers can feel helpless because also they don't completely understand the experience of the person with chronic pain. And honestly, even the kindest, most compassionate caregivers will never fully understand, right? So the person with chronic pain has the sense of being alone with that, and so does the caregiver, who can become overwhelmed. And if you share that with each other, it's just going to bring you closer, and it's going to be much easier to solve problems. It's okay to tell each other what you need. I have to spend a lot of time with my clients saying, well, let's practice this, because it's okay to tell them, I feel like this, so I need this. let's do this small like communication strategy during the week to help be more aware of that. People don't, honestly, they're on autopilot. They don't feel like the emotions of guilt and shame on both ends. They don't feel like that it's okay to share that, and it's necessary and very human.
Wonderful. Great thing that I love that you ended with was human. We all are people at the end of the day, and we have emotions and we have experiences, and we bring those with us everywhere we go. So, Ed, I'm going to add a question for you and your wife, Kristen. So, how does your family handle holidays and family gatherings when you can't really predict what the pain levels are going to be? So, you're hosting or you're going somewhere, there's holidays. How does your family navigate pain in those spaces?
Yeah, that's a good question. Even though I'm an elected official, and you would think that I would want to be engaging with everybody often, I still struggle at family events. To be honest with you, I like to go to family events for a period of time, and then I like to come home and to relax. And large crowds can be challenging. Maybe it's because of the experiences I've had in the military, but I do have to admit that it can be challenging at times, and engaging with everybody in conversation. And sometimes you just like to relax and watch a sports events, and not be at an event all of the time. So I think everyone deals with it differently. And I think for a period of time, I'm very good, but after a period of time, I get restless, I get tired, and I want to make a change. And that's how I feel. Sometimes in life is trying to know when it's time to leave an event, or to go home, or to relax, so you're not so overwhelmed or become stressed out. And I think you need to make sure that you are healthy, because you're only effective and you're only a good parent or a good spouse when you're feeling well. And you don't do anyone any good by not taking care of your own physical and mental health.
Can I add to that, Ed? Because that is such a good point, and it reflects on something I said earlier about expectation management too. And I think when you recognize that need, you can set the whole family up for success, like going in with a plan. If the plan is we're going to stay until the party's over, right? And then there's a sense of disappointment, like we failed because we could not stay until the party ended. But if we, as a family, know that like after the meal, we're likely going to head out, or we have a plan that dad's going to leave, but the kids can stay and we'll take two cars. Like you can think about that preemptively and do it in such a way that it's thoughtful and doesn't feel like a loss or a failure or disappointment, because you know your needs. And so it might be a hard pill to swallow to open up the conversation as a family and say, we do know we have this need in our family. But when you do it ahead of time, I think you can take out some of the additional stress that might come.
Yeah, doctor, that's a very good point. That's exactly how I feel. Is I know that balance that I need to go through. And, time management is also a part of it. And spending quality of time with your family is important, but also your health is important. And being at events and not feeling good, or not being in the best of health, is not doing anyone any good. So I factor in time management, but I also factor in what's best for my family, and providing the best time I can, quality of time with people. But at times it's not extensive. It's not a lot of time, but for my immediate family, I spend as much time as I can with my, wife and kids who are in college. But that's what's important to me, is making sure I'm physically healthy and mentally healthy to be a good parent and a good spouse.
Wonderful answer. Wonderful answer. We are not our complete self. We can't do anything for the people that depend on us. So that was a really great answer. Alrighty, guys, as we transition after this last question, I'm going to hand it over to my colleague Erica to close us out with some really great information. I'd like each of you to leave us with a final sentiment. Think of the families that came to this presentation. They're struggling with chronic pain and trying to figure out how to navigate. What would be your send-off line to those families? Anybody that comes up with theirs first, let's go ahead and shoot for it.
I don't think I can do a line, but what I really want people to leave people with is that the latest psychological treatments for chronic pain that are mind-body based, very evidence-based interventions are also very effective. I also have a chronic pain and I have lupus and RA. So I've used these myself. I've had great change for myself and my clients. And the other thing I would say is that the VA in particular has a very good integrated pain program, but they consider balance and biopsychosocial aspects. And they're also integrating these newer mind-body psychological therapies. So I think that's it.
Perfect.
I can piggyback off that. That was a really hopeful message, and I can add to that. I'll reiterate that there are great evidence-based treatments for managing pain and coping with pain, but that's an individual and as a family. So I'm so glad that you highlighted that. And I'll also add another hopeful piece of information, which is that families are inherently resilient. People are resilient. So I think it's easy to focus on risk factors and fears and worries about everybody in the family and how they'll cope when there's some adversity. But it's amazing what families can do and what humans can do. And so I'll leave you with that.
Thank you. I will say briefly, other than the support I receive from the medical community at the VA and organizations such as the Arthritis Foundation, one of the aspects I wanted to mention, although I don't do it as much as I like, but the role of exercise is critically important for chronic pain, mental health. And again, it's easier said than done, and I have neglected that for a while. Walking, I used to love to walk with my wife, and I haven't done that in a long period of time. But if there's like a commitment I want to make, it's getting back into shape and exercising, because when I'm exercising, my mental health is 1,000 times better than when I'm not exercising.
Awesome.
Thank you.
Guys, make sure you're getting your steps in. That was a great way to leave us. Make sure you're exercising. Motion is lotion. I promise you, your body will feel better, even if you have some pain. If you get physical, if you move around, you can at least keep your mind off of it. So as we wrap the presentation, I do want to transition to another slide. I want to bring in Erica. She is my colleague. Before that, just want to say thank you for all that you guys do for us. We will have this recorded, and take it away.
Good evening, everybody, and thank you to all of our panelists. They've been incredible. I hope you've enjoyed the content that we have for this evening. It was really a labor of love, as it is every single year, and we appreciate you joining us. I want to thank Asia and her team as well, because we couldn't do this without them. So we have a couple of things for you to keep in mind as far as available resources. We have an 800 helpline or an email that you can send. Any questions, concerns, things that you just need to be pointed in the right direction. We have a Spanish speaking component, as well as obviously we have it in English. So please feel free to reach out. And even if we're not the ones to help you, we can point you in the right direction. And then Asia, would you just advance the slide for me? Great. We are just going to take 2 seconds to thank all of our sponsors. First, our national sponsor, Boehringer Ingelheim, is our first one. Then if you take a minute you can look at the slide or don't have to. On the next slide, we also want to thank Amgen, who is in the gout field and is doing a lot of great work for gout and for patients with gout. A lot of people who have osteoarthritis also have gout, so it's a good thing for you to check out. And then, perfect, we have some upcoming webinars that we think you might be interested in, including Aging Gracefully and the Balancing Act of Caregivers and Arthritis. You can register through the link that's right there on the screen. You can always check out We usually post our upcoming webinars 3 months in advance. And you can check all of those out on our website at arthritis.org. Also, last but certainly not least, tomorrow night at 6 p.m., we have one of our Military and Veteran Services Connect groups. This is a group of people, all who've served in the military. They spend time part social support, part educational. They drive their own content, and it's all independently led by individuals like yourselves who have served or their family members. We hope that you will join us, and we want to thank you. There's going to be a post-webinar survey that gets sent out. We really do take a lot from those surveys. We glean what we shouldn't be focusing on next. So if you just take a few minutes to answer it, we would be very grateful. And lastly, we want to thank our sponsors for tonight's event, especially Johnson & Johnson and also the City of Boston, who have been incredibly generous with their support of these kinds of programs, and our community partners, the Disabled American Veterans Association, AARP, and what we lovingly call the MVSOA, which is the Massachusetts Veteran Services Officers Association here in Massachusetts. We want to thank every single one of you. We could not be doing this without you, so thank you. And I think with that, we want to say thank you to everyone and wish you a fantastic evening. And please feel free to reach out with any lingering questions you may have. Thank you to our presenters, and have a great evening, everybody.